Hello everyone, I'm Dr. Sean, sports orthopedic surgeon dedicated to keeping you active and healthy. Today, I want to talk to you about something crucial for your knee health: meniscal root tears, and why it's so important to address it. Think of your meniscus as the shock absorber of your knee joint. The two meniscus within the knee joint attaches at the front and at the back of the knee joint, forming a shape of a ring. Now, every time you jump and land, it maintains the ring structure in order to cushion and dissipate the force. This is known as hoop stress. One way to imagine hoop stress is to think of the metal rings around the wooden barrel. These rings hold the barrel together and maintain its shape under pressure. Similarly, the meniscal roots anchor your meniscus, allowing it to handle the hoop stress every time you move. When a meniscal root tears, it's like one of those metal rings snapping. The meniscus starts to shift out of place, a condition we call meniscus extrusion. Why is this a big deal? Without a stable meniscus root, your knee loses its natural shock absorber. This can lead to increased stress on the cartilage, accelerating wear and tear and potentially leading to arthritis. Reducing the meniscus back into the knee joint and securing it is vitally important. Surgical treatment allows us to re-anchor the meniscus. It restores the function and protects your knee from further damage. The procedure is minimally invasive, and many patients begin their recovery journey immediately after surgery. Recovery time varies, but most patients return to their normal activities following a tailored rehabilitation program which may last for several weeks. Imagine getting back to the activities you love without knee pain holding you back. Addressing a meniscal root tear promptly is essential. Taking action now can make all the difference in preserving your knee health and preventing future complications. Your journey to healthier knees starts today.